Good evening, ladies and gentlemen. It gives me great pleasure to invite all of you to the launch of the 8th edition of the Tips on Retina Practice, a practice series. And to inaugurate this 8th edition, we have with us none other than the venerable, the venerated, the highly respected Chief of Dr. RP Center, AIMS, New Delhi. We have with us Professor J.S. Titiyal. He needs no introduction. One of the foremost international keratorefractive surgeons. There is no challenging surgery that is not there in his repertoire. And more than anything else, he is always ready to help the youngsters, and his lectures on the basics, the fundamentals, especially phaco, are an absolute treat and an absolute must for every resident, for every beginner. And he makes everything sound so simple. You come up with complex problems. He's always got a smile. He's always got a solution. So, ladies and gentlemen, please put your hands together for Professor Titiyal. Good evening, sir.
Good evening. Very good evening, Dr. Sanjay and Dr. Jatinder. It's real pleasure to be, in this particular episode, which is going to be, you are saying inauguration, but I know that, this series is going for us so many years now.
I started with COVID.
Yeah, during the COVID time. And I think COVID has given us so much of learning to do. And many things came during COVID, a lot of innovations. And this, tips, it's practical tips is a real, boon to younger people or those people actually who are practicing retina, and people like us also who don't actually practice retina. But it is a very important integral part of any procedure, any examination, for all of us to know, which are those small clinical tips which can make the, change your perception into looking into retinal disorder, disease. Actually, to see a normal retina also, you require these tips. So it's a wonderful contribution from you people. And normally, I always like to read the entire, whatever tips you give, right from the number 1 to now. I think it's almost touching so many series. And many people would be reading those, but I'm sure most of us will benefit, especially the younger people who are doing, the startup of their retina practice, learning something. If you give a small tip, then that brings the, enthusiasm from young people. Sometimes we see read the entire chapter, but you still don't get anything. But this tip will give you incentive to go back, read the entire thing again, look for those pictures in their patient, try to pinpoint, and that is how we learn all these things, And I appreciate the contribution from your side. It's really wonderful, and the compilation of the entire thing is going to be a much more, I think, you say to learn things, you have to see the other person. And to practice, you have to learn from the other person's practice, and how the small steps, small saying changes the bigger aspect of clinical practice. The wonderful. I really like to give a thumbs up to you two people. Congratulations for doing a wonderful job.
Thank you so much, sir. Sir, if you could dedicate this book to the nation, actually, you're right. I should have actually said that this is the book launch.
Yeah, that is true, Jatinder. It is a launch and wide nation, it is a dedication to entire community of, medical practitioner, especially doing an ophthalmic practice. And it should be useful for everybody sitting in across the world, all the people who are actually looking for these tips. And it will be beneficial to entire country, young generation, and the other parts of the world also. So it should be a international tips for everybody.
Okay.
Sir, if you could declare it open, please, sir.
Yeah, I it's my pleasure, honor, and absolutely I'm delighted to say let's absolutely.
Thank you.
And
Great.
reaching up to
Ahuja?
8th edition, it is also big effort, because to bring out those tips, you have to know the entire area. It's like picking something from a ocean, and giving to people. If I have to dive and get something from the ocean, it will be so difficult. But you people have taken out that to your people to learn in a minute. It's like getting so much information in a very small frame of time. And I strongly feel, I read that, sometimes I feel I should know this. And it is so simply, put everything together. Wonderful,
That is,
wonderful.
you have, that means you have read some of the tips at least.
Yes,
Great.
I have read, definitely,
Acha.
especially
Great.
somebody putting an extra comment on that. And then I
Great.
see, why this comment is there. Let me see again, And
Okay.
that is how you start learning. And because being in an institution like ours, where you have to interact with everybody, and when you are invited to be a teacher, examiner, assessing somebody, and there you can't say, I don't know retina, you have to learn those small tips
Okay.
also
Great.
sometimes.
Right.
So
You
actually
can
what
ask the
happened?
questions from the PG from this only.
Yes, that is, and some of the tips, like I feel it will change the concept of a person also, because it's very difficult to understand, read every books, and you say, okay, this is a tip which is important for this particular diagnosis. This is important for a subsequent observation. What should we see, and how to differentiate this from this, and that is wonderful tip. Very nice.
Sir,
I
actually,
hope that it keeps on going for so many other series. And I appreciate other people also working in this area. People working in the cornea, cataract, refractive, ophthalmoplasty, oncology. They
Okay.
should come out with these small tips also. Yeah.
so we're
Great.
looking
And
forward to video tips from you, sir.
no, I'll be working on that once I get a
So
little
small
more
video
time.
tips, because you give that insight actually. The crux
Mm.
part of the surgery, you make it sound so easy. You're the coach. So it'll be so much fun to have it in your inimitable style.
But
Mm.
it requires team effort and people who
Thank
make your thinking translate into these small things. And it's the talent also to pick up things also. Like everybody would think, but difficult to execute in a right manner.
So
But
your
yes,
videos are fantastic. It's like, it's so much fun watching your videos with that inimitable style of yours. So if that could come to people who don't
yeah,
have the good fortune of
right.
being
yeah,
at all your conferences, because nowadays with so many conferences happening, it's really difficult. So
yeah, that
probably
is true.
there's a reason to have video tips from you.
Mm.
Okay. I,
That'll
I
be
take
great
that
idea.
as one of the challenge, and maybe we'll come out.
Great.
And thank you so much, sir. You've really, we are honored that you took out time. Sir was out. He was out of station. Then he was busy
Right.
with another meeting, and then he's taken out time for us. And thank you so much, sir. So it's so
No,
nice
it's my
Thank you.
to have you,
pleasure.
sir.
Thank
It's my
you.
pleasure.
Thank you.
And again, wish you all the best, and many heartiest congratulations that, to bring out this 8th edition. I'm pretty sure much more will be there. And tips cannot end, you can bring out tips for anything, and which will
Mm.
benefit and in fact, it benefits us also who are actually doing that. To bring out those tips, you have to work so hard to get these things. And
Okay.
again, I hope that this goes to everybody and seeps into everybody's mind, so that they practice better. Thank you again for having this
Thank you.
wonderful inaugural meeting.
Thank you so much,
Thank
sir.
you.
Good night,
Thanks a
sir.
lot. Thanks a lot. Thanks a lot.
Thank you, sir.
Thank
Okay. Good night.
Good
Good
night, sir.
night. Thank you.